Well, public health is the people who help the cities conquer the plague and cholera and typhoid.
I don't know.
Public health. I would say keeping
sanitization.
Yeah, public sanitization. What do you think?
Public. Just the healthiness of the public.
Well, I interpret public health as services for people that are needing health care. You go to the hospital to get service, to the doctor, right?
Public health system is universal health care.
I don't know.
The challenge of public health is to help bring about changes in society that will advance the health of communities. But the starting points are not always the same. The things that promote health are not equally available in all communities.
It's hard to define public health because it isn't just the kinds of services we associate with public health departments. It isn't just inspecting restaurants to make sure that they're safe in the way they handle food and store food. And it isn't just the immunization of children against communicable disease. Those are activities that are very important to public health, but public health is a concept that I think is bigger than that.
If you look at what has changed the health status of a group of people or a population, it certainly hasn't been that we've been able to take tonsils out more efficiently, although that's important, I don't belittle it. But when you look at what public health is, it has a far greater impact on a broader range of population.
A community that offers quality education, an adequate income, meaningful work, safe, affordable shelter, a good food supply, clean water, and sanitation increases people's access to health. People need organized health services that respect cultural differences and people's right to control their own health.
I think a big part of it comes from something that we're really bad at doing, which is acknowledging that this is who we are, that we do these things. We drink, we have sex, and sometimes we make bad decisions. So let's be realistic about that and try to do as much as we can to help ourselves make good decisions.
We often hear community and environmental groups raise questions about the effects of the social and physical environments on health.
We need to look at some of the broad issues behind health. Poverty is clearly a big one. There is a close correlation in all kinds of areas between poverty and poor health.
The issues are often complex, and difficult trade-offs must be made. We need regular and open public debate to resolve these issues. Public health advocates add their voices to this debate. The responsibility for action is shared between government, health advocates, and people in communities. There will always be a need for quality medical care and treatment. But through public health, we can greatly reduce the need for treatment simply by keeping people healthier.
So we have to start focusing our efforts and our time and our energies on public health and looking much more seriously at health promotion, health education, and preventative kinds of programming.
The money we spend on public health is an investment in the health of people, in the productivity of our nation, and in the future of our healthcare system.
Equity in public health is about dealing with those things that are unjust and unfair and eliminating those kinds of barriers that prevent or make it very difficult for us to achieve a universally healthy community.
We benefit all of society by eliminating some of the problems that cause a great deal of cost to society, but at the same time, in order to maintain the fabric of society, we need to make sure that everybody has access to the services and programs that they need in order to be contributing members of this society. So even if we only care about the bottom line, the dollar figure, even then I believe it's a good investment to invest in targeted health services.
Health advocates, government, business and industry, and other groups support communities with healthy public policies, employment, and other resources that help people direct and improve the health of their communities. Together, we can work to build a vibrant economy that will close the gap between rich and poor and make health more accessible to all. The Alberta Public Health Association is made up of health advocates, community groups, and members of the public who are dedicated to improving the health of Alberta communities. The challenge is to ask the tough questions that will promote dialogue on the things that make people healthy. By listening to and working with people in communities, the Alberta Public Health Association is a voice for the public, advocating policies and actions that will keep people healthy.